Hello everybody. Well, I like very much the topic of blue lesions, because blue lesions are in some way concerning by definition, because blue color is something we interpret as something deep, and this is the reason why they are concerning by definition. As you can see here, these are the colors, and the colors we can see demoscopically, and the colors correspond to specific layers of the epidermis and the dermis. So whenever we see black, the melanin or the blood is just superficial in the stratum corneum. When we see brown, it means that we have melanin within the epidermis. Gray color when we have pigmentation along the dermal papilla, so very superficial in the dermis. But when we see blue and red, it means that we are more deep into the dermis. Another point why blue lesions are concerning is because blue color per se is highly unspecific. The only lesion which can be diagnosed only because of the presence of blue color is blue nevus. Okay, but in general, blue color is highly unspecific. Look at this lesion, for example. This is a blue lesion clinically, and this is a blue lesion dermoscopically. There is also some kind of white shiny lines, some grayish globules and clots, but certainly it's a lesion that it's difficult to be diagnosed clinically and dermoscopically. The lesion was excised, and by the way, also histopathologically, the lesion was very difficult to be assessed by the pathologist. So there was just the presence of melanophages, so no possibility to understand why there is this intense regression phenomenon and what was the lesion before. So in some way, blue is unspecific, and that's why we can only diagnose bluish lesions only when we are able to check, when we are able to assess what is found around the blue color. Okay? So for example, here we see that the lesion is bluish, especially in the more pigmented area on the right side, but around the blue color we have specific clues. So we have multiple milia-like cysts, and we have multiple comedal-like openings. So this is a bluish seborrheic keratosis. Okay? So what kind of lesions can be blue dermoscopically? Well, we have several. In the spectrum of melanocytic lesions, mainly we have three possibilities. We have blue nevi, we have spitz nevi, and melanoma. And in the spectrum of non-melanocytic pigmented lesions, we have many more. We can have basal cell carcinoma, vascular lesions, seborrheic keratosis, other lesions like dermatofibroma, especially the hemosiderotic variant of dermatofibroma, but also adnexal tumors and many more. Okay, but these are the 6 most common types of lesions which could be predominantly blue in dermoscopy. Okay, so for example, here you see 4 very nice examples of angiokeratomas with a very prominent bluish component. And so again, based on the blue color, we cannot understand what they are, but since we can recognize clearly this kind of black to purple lacunas, then we are of course able to assess these lesions as vascular lesions, and because of the presence of hyperkeratosis, these lesions can be diagnosed as angiokeratomas. Here again, a predominantly bluish pigmented lesion in which we can recognize, together with the blue color, a very nice sharply in focus vessels. They are not really arborizing like we expect to be in basal cell carcinoma, but they are sharply in focus. Therefore, these are the vessels we can recognize in basal cell carcinoma. Okay. Here we have another predominantly blue lesion, which is composed, by the way, by two areas. One on the left bottom side, which is showing a globular pattern, so it's a banal looking globular nevus, common nevus. On the right side we have a lesion which is blue, but at the periphery we see a lot of streaks quite symmetrically distributed around the periphery. So this is a combined nevus, congenital, a small congenital nevus plus a Spitz nevus, so pigmented Spitz nevus. Okay, and here a classical example of a blue nevus. This is the only lesion, as I told you before, that can be diagnosed only because of the presence of blue color. But blue lesions, blue nevi, usually, of course, they are very blue in color, but not always. Sometimes you can see some variable degrees of white coloration within, together with the blue color, especially in this other lesion you see here, and this is due to the presence of fibrosis together with this kind of heavily pigmented melanocytes, which are located deep into the dermis of a blue nevus. Here another example of a combination of blue color and white color in a, let's say, quite stereotypical example of blue nevus. Here, this is a blue nevus located on the scalp of a, let's say a 60, 70-year-old gentleman, and here you see a lot of vessels. These vessels are not sharply in focus like we expect to find in a basal cell carcinoma, but especially on the scalp, a blue nevus, which is typified by a deep dermal component of melanocytes. This is the reason why, since the skin, the epidermis is quite thin, we are able to see the vascular structures, the normal vascular structures, which are located above the dermal component, the pigmented dermal component, and that's why we see often this kind of vessels in blue nevi located on the scalp. Okay, so the management of blue nevi is very easy, meaning that usually they are morphologically typical, so we don't need anything more, but sometimes blue nevi can be a little bit peculiar from a morphologic point of view, like a case like this one, in which we were not completely sure, is this a blue nevus or something more worrisome? Of course, the history can be an additional clue, but anyhow, please don't take too much, don't give too much importance to history, because history is something subjective and could be in some way not telling completely the truth of the situation. So just always base your diagnosis on what you see morphologically, and if you are not sure morphologically, it's better to excise the lesion. Of course, the lesion, a bluish lesion, again by definition can only be either saved, so you don't do anything, you say to the patient it's just nothing, or you excise it. There is no chance to make a follow-up for bluish lesions. Why? Because, I mean, a follow-up of a bluish lesion is a risky procedure, because if we are not sure to send the patient home, it means that there could be something, and if this something it's a melanoma, it could be a thick melanoma, and therefore it's better to excise it immediately. Okay, now another example of a predominantly blue lesion, but here again, what do you see around the blue color? Well, we see a lot of black color, black dots and black blotches, and also a little bit of a network at the periphery. Okay, so here the presence of the network is mainly the main characteristic why we think that this could be a nodular or a predominantly nodular melanoma. Okay, so the combination of blue and black color, let's speak for a moment about it. We published a few years ago a study in which we demonstrated that sometimes only the combination of blue and black color is the key to diagnose a nodular melanoma. Okay, why? Because nodular melanoma could be lacking of the typical melanoma-specific criteria like atypical network, like streaks, like black dots, like globules, like regression, and so on. So you only see a predominantly bluish nodule, but very, very often nodular melanoma is also showing a black component in terms of color. Okay, so the combination of blue and black is something to take very seriously into consideration, and this is an example of a nodular melanoma predominantly showing blue and black color. Okay, so this rule for me, it's extremely important. Again, here an example of a nodular melanoma or a thick melanoma showing a lot of blue color but also a lot of black color. There is a little bit of ulceration in the center, and of course also some globules, especially top right. Therefore here I don't think we have problems in diagnosing this lesion. So when we did this study on the blue-black color in melanoma, we found out that only 7% of negative lesions, so lesions do not show the combination of blue and black color, are found to be melanoma. It means that this combination of colors, it's extremely frequent in this type of melanoma. Okay, and on the opposite, only 9% of positive lesions, so blue-black positive lesions, are found to be benign. So it's a quite sensitive and quite specific criterion. Okay. Now, of course, also there are exceptions also in terms of also in the realm of this blue and black rule. Of course, we have to make sure that the black component of the blue-black coloration is not due to the presence of comedons, of comedo-like openings, and also we also have to make sure that the black component is not related to the presence of lacunas, of vascular lagoons. Okay, so here you see an examples of blue and black lesions, so lesions positive to the blue-black rule, but as you can see clearly in all these cases, the black component can be easily identified as a specific structure of seborrheic keratosis, meaning namely multiple comedo-like openings. Okay. And here two examples of hemangiomas in which you see a combination of blue and black, but again the black coloration is recognizable as a specific structure we find in vascular lesions, which is the presence of lacunas. Okay, so blue-black color, extremely important, especially for this kind of difficult to diagnose nodular pigmented melanoma. Here another example, mainly typified by the presence of blue and black coloration, and this was a thick melanoma. Okay, so as I told you, the sensitivity and specificity is very high, so use it. It's extremely nice. By the way, there is a much more recent paper published by Costantino Lallas and Emilio Lallas. Costantino is a nephew of Emilio, and they performed a very nice study on the demoscopic predictors of benign and malignant equivocal lesions which are predominated by blue color. And what they found out? They found out that there are three potent demoscopic predictors of benign lesions, which is the extension of the blue color in more than 75% of the surface, the presence of diffuse distribution of blue color, and the absence of vessels. Okay. In contrast, there are three predictors of malignancy in the context of bluish lesions, which is asymmetric distribution of blue color, the presence of blue clots, and the coexistence of gray color and linear vessels. Okay, so this is also something which we should take into consideration. Here on the left, you can see a classical blue nevus, which is predominated by the three features mentioned by the two lalas, which is blue color occupying the entire surface, so more than 75%, the homogeneous and diffuse characteristic of the blue color, and the absence of vessels. While in the center and on the right side we have two examples, one of melanoma and the other one of BCC, in which you can see that the blue color is not occupying more than 75% of the lesion. There are vessels on the right side, and there are also irregular distribution, asymmetric distribution of the bluish areas in the lesion in the center. So additional criteria which could be helpful in the context of predominantly blue lesions. Okay, now maybe I can skip these additional lesions, but these are just again outlining the same concept. You see here a blue nodule, but you can see also black color. Therefore, please raise your index of suspicion in a lesion like this. And this was again a nodular pigmented melanoma. So, in summary, these are blue lesions. Blue lesions are these 6 mainly that I showed you until now. And what we can say at the end of the day, use these kind of clues that I mentioned before: the blue-black color, the blue-black combination, also the 3 benign criteria and the 3 malignant suspicious criteria that you can find in predominantly blue lesions. And at the bottom line, you know, it's always a very good rule to biopsy any blue lesion that cannot be clearly diagnosed as blue nevus, hemangioma, or seborrheic keratosis. This is at the bottom line really the most important rule to remember. So don't make follow-up of bluish lesions. This is not advisable. Either we know it's completely sure it's a blue nevus, send the patient home. It's an hemangioma, send the patient home. It's a seborrheic keratosis, send the patient home. If not, if you are not sure, we have to excise the lesion. And with this, I thank you for your attention.